I want to do a little demo of how we test a baby. Obviously, with using kinesiology, we can't muscle test a baby. So we do something what's called indirect testing, where we actually test Laura or Mama. And we use our little Grinch baby here for an example. We just hold the baby, or if it's somewhere around age 7, 8, 9, they can start to test on their own. But we just use Laura and the acupressure points of the baby. We know that neurologically, for instance, if you have a heart attack, you feel pain in the shoulder over here, so we know there's a connection. So we can use what we know to just test through. So we can use the neurology to assess for an oversympathetic state or an over-parasympathetic state, so that's the rest and digest. And we use massage as a parasympathetic, so we would massage to that area of the skin. And we'd get some feedback. Hopefully we don't get any weakening. I think Grinchy is really healthy. And then we would pinch. And we'd be putting a sympathetic stimulation into that. And if we get a weakening effect, we would find something that helps that out. So we'd grab a nutrition that's good for the heart, and we'd see if it normalizes that reflux. We might grab a food. We're wondering about how the baby's doing with cow's milk versus soy milk or something like that, and we hold it on a little vial of cow milk and hold it onto the spleen. Hold it onto the thymus, that's our immune system. Maybe hold it onto the digestive reflex points and see if we get a weakening effect with that. And if we do, we might want to avoid that food or switch to a different. And we might even apply something that's anti-inflammatory or soothing to the system. See if we can offset that. We can just go through the system and touch each of the acupoints and see if we see a stress response in any of those points. So it's kind of like asking, the baby can't tell us. It'll tell us that it's unhappy. And even young kids, a lot of times they're unable to put into words what distress that they're feeling, or they might be able to, as they get older, say my tummy hurts or something like that, or my head hurts. This actually energetically and neurologically gets in and asks, what do you need? What are your wants? What are your needs? And for the most part, we see some pretty remarkable shifts when we start meeting those needs from a clinical standpoint. So that's how we test the baby.